It is very unacceptable, and for me, one statement just stands true. This is the case of public officials taking personal concerns first, whether it is the management of the hospital or even it is the institution that called for the strike, the go slow, whether it is the senators who delayed county revenue allocation, whether it is the people within the county government who have delayed payments of a lot of stuff, whether it's the people in the Ministry of Health who've done the wrong thing when it comes to the NEMS holistic medical equipment services. All of these people stand culpable for the chagrin and anguish that this particular woman went through. But she's emblematic, as George Floyd was, to the wider systemic problem that Kenyans face because of corruption. The services that we get are almost a favor when officials refuse to appear in office, when officials choose to delay because they don't feel like coming to work, when officials decide that their strike is more important than human life. All of those people stand guilty, not only for this particular woman having been forced to give birth on the side of the road, but for the many thousands who've died. And I'll give you an example of Ken Walibora Waliaula, who died the other day simply because he could not get medical attention as and when he needed it. And that underscores a bigger problem. It underscores the problem that Kenya, once again, is a country full of good intentions, but we consistently are driven to hell by the corrupt and selfish leaders that keep making these situations a norm in our country. So what is the solution? Solution number one is we must seriously sit down and push the president and the CS of health to deliver on universal health care. Every woman, every human being in Kenya, for that matter, has a right to access quality healthcare minus corruption. That is what the Kenyan people must demand. And if we are going to demonstrate, let's not demonstrate until someone is fired in the management of Pumwani. No. Let us demonstrate until universal healthcare is put in place. And when women go to our hospitals, they're not insulted, they're not slapped around for simply being in labor. That is what we need to push for, and it needs to be a standard every Kenyan should be willing to give everything to see happen.
Rosalind, talk to us about this incident.
Ben, I also agree with my colleagues, what they have shared.